Hi, welcome to our monthly webinar series about nutraMetrix. My name is Sarah Tegender, National Sales Manager with nutraMetrix out of the Boston area. I've been an independent consultant and certified with nutraMetrix since 2006, and I am very thrilled to be working closely in the field to bring you the latest enhancements when it comes to our product, our marketing, and our in-field support. Tonight, I'm going to give you a little bit of an overview about nutraMetrix as a company, where we're headed, and just the state of healthcare as it is right now, November 2016. But what are we looking to do here? Well, we provide a complete suite of customized cutting-edge solutions. So many different solutions. I was actually talking to one of our consultants today, soup to nuts. We really can help make practitioners, just time and practice, a lot more efficient, a lot more profitable, take a lot of those headaches off of their plate. We have a wide variety of products and services that do this. We better serve patients, but we also generate some ancillary income for the practice. Our information is relevant and our training is superb because it's an ever-changing healthcare industry. As we know now more than ever, that there are so many shifts, cosmic shifts, and change, to November every 4 years, there's always a lot of change. And I think that nutraMetrix has always been poised to help be there for the healthcare system. We fit so nicely and synergistically in light of the fact that business costs are astronomical. I have a friend who owns a clinic, and her rent alone is $7,000 a month. That's just her rent. That's before she even turns the light bulbs on. On the patient end of things, drug costs are higher than ever. I have friends, my friends, we're now, all starting our families, starting our homes. We're a few years out of college. I have friends that have mounting medical bills, and they're in debt because of starting families. They're in debt because of rising drug costs, medical things that have happened to them. It's such a shame. And on the end of the practitioner, they're shrinking insurance reimbursements. They're not sure if they're even going to get paid for the services that they provide. I know of a practitioner that spent 45 minutes with a patient and got reimbursed $4.64. I mean, it's an uphill battle every step of the way. And like I said, as we are here, November 2016, regulations are going to continue to change. Reform initiatives are going to continue to change. I think that's the only thing that is constant is change when it comes to the healthcare system. And so for better or for worse, things are going to get shifted. We saw this shift in about 2008 to 2010, when a lot of practitioners were forced into electronic medical records. We saw what that did. We saw what changing healthcare reforms out of Washington did just a few years ago. And my big prediction is that things are going to continue to change. And some to make it safer and better for patients, but there's always a cost associated with that. And a lot of times that cost is passed on to the private practitioner. It's not going away. I mean, you pick up any newspaper, any article, can see Forbes in 2015, they were saying that multiple pay cuts were hitting doctors then. The Medicaid cuts are going to have an important impact specifically on our family practitioners and those who have increased the number of Medicaid beneficiaries. So that was a huge issue in 2015. We see later in that same year, end of Medicare bonuses will cut pay to primary care doctors. It would mean a pay cut of $17,000 per practitioner. And this is because of a Medicare incentive program and a Medicaid bonus program that ended in 2014. So doctors were scrambling to make up that lost income. We see here, February of 2016, United Healthcare, the biggest health insurer in the country by membership, said it was considering exiting the healthcare law's individual marketplace. They were just deciding to not even offer their services anymore. You can see this is from the Post-Gazette. what are the alternatives? Because if you have these rising business expenses, you have decreased income, you have to fill in some sort of a gap. So what are practitioners looking to do? Well, according to Medscape.com, that follows the trends in healthcare, more practitioners than ever are showing ancillary services. These numbers just continue to go up as we follow them with nutraMetrix for a few years now, where 23% of those family physicians have decided to offer some sort of ancillary service, whether it's weight loss, in-office diagnostic, nutrition, cosmetic, acupuncture, massage, and they might even be able to earn as much as 15% or more from these ancillary services. We can see too, it's not just limited to our family physicians. The chart here on the right, orthopedics, anesthesiology, gastroenterology, ophthalmology, urology. I mean, just about everyone is offering something else and looking to fill the gap. And so one of the solutions that we found is, let's look at what already is going on in the marketplace. Let's see where nutraMetrix might be able to fill in here. Well, we know that $40 billion a year is spent on supplementation. Twice as much is spent on weight loss. And 8 out of 10 Americans, 80%, and these are Americans that are walking into medical facilities and medical practices every single day, have great confidence in dietary supplements. 55% of them would prefer their doctor to make the recommendation, to just guide them on their journey towards wellness. Because otherwise, if they're walking into the grocery store, if they're walking into their local vitamin shop, health food store, whatever it is, they're seeing some really great, attractive labels, popular brands that you see on television, that you're reading about in magazines. But if we really look into the list of ingredients, we're seeing things like artificial chemical dyes, flavoring agents, preservatives, disintegrating agents, bulk fillers like talc, starch, hydrogenated oil. Things that I personally would not want to take every single day. I mean, we look at a popular label like Centrum for adults 50 plus, and we're seeing things like hydrogenated palm oil, like talc, like some dyes. Again, not something that I would want to put in my diet on a daily basis. And certainly when we look to our children's vitamins and our children's supplementation, again, not things that I would want to give my own 3-year-olds, that I would want to give my family. Sugar right up there at the top of the list, artificial flavorings, starch, all these sorts of dyes in this. And I mean, these two brands are not alone. A lot of brands, you really have to look into it to say, is this truly something that is helping or hurting the state of healthcare? What I really like about nutraMetrix is the stability of the company, because we are part of a much bigger company. You can see right here, corporate headquarters. It's down in Greensboro, North Carolina. It's a division of a company that's 23 years old. We've always been in the right place at the right time, helping health professionals generate additional revenue for their practices while providing the wellness-based products and services that the patients are asking for. We have an A+ rating with the Better Business Bureau, and in 2013 we were a Torch Award winner for trust, performance, and integrity. This is a company that has built to last. Our mission is that we believe that patients should have access to recommendations for healthy living and products that promote optimal wellness directly from their trusted health professionals. This is why everything we do is focused on helping health professionals implement customized wellness programs that benefit the patient and the practice. And by providing health professionals with science-based nutritional interventions, revolutionary technology, wellness-based education systems, and trained implementation consultants, nutraMetrix is changing the face of healthcare, one health professional and one patient at a time. It's a $40 million division. Since we started in 2004, despite some cosmic shifts in the economy, we have continued to grow to the $40 million division that we are today, and as we set our sights on international expansion in the next couple of years. One of the advantages that we have and what has continued to fund our growth is the fact that we're a product brokerage company. So we can identify the latest market-driven products from the best manufacturers. We can have comprehensive and synergistic formulations and a wide variety of products that are based on what's going on from the experts. We at nutraMetrix have such a commitment to quality. If you ever have an opportunity to go visit our quality control department in Greensboro, North Carolina, that is something that I encourage many people to go and do, because to watch and see how every product is manufactured with strict quality controls, with specifications for raw materials and finished products, with certificates of analysis, all for GMP compliance, and then they enter our warehouse and are double inspected for damage, label accuracy, appearance, taste, and odor prior to release. We did not manufacture these products, so if these products are not up to our standards, they do not leave our warehouse. I think that is the most ethical way to be able to do things, and at the same time to be able to stay fluid enough within the marketplace. Our flagship line is our isotonic capable nutrition, or isotonics. This gives superior nutrient delivery since it is a comprehensive and synergistic formula, really, of powders and crystals that make some really great, unique blends. Health professionals love it because of the delivery system, because it can rapidly go from the stomach into the small intestine to get absorbed efficiently. There's better compliance and better results because patients find that it's really easy to take, they like the taste, and they feel the results. And so you can see we have such a wide variety of products, from antioxidants and calcium and B vitamins, a prenatal, a skin health formula, bone and joint. And our health professionals said, well, we would like to have something that's customized and unique for our own practice or for each patient. You know, this thing of personalized medicine, of individualized healthcare with reliable patient results, give better patient compliance, and just make it really easy for the patient to be able to take something, easy refills with auto ship. So you can see our nutraMetrix custom cocktails is the solution we have there. This is a product that is probably one of my favorites, which is our GeneSNP DNA analysis. We're right on trend with nutrigenomics and genetic analysis. This particular test tests 48 genetic variations, 22 of them which are related to obesity. It makes it a really great test for just about all practitioners because of the amount of genes and the comprehensive depth that our clinical guide goes into, because each practitioner is given a whole clinical reference guide where they can use that to create a customized wellness plan for each patient. It's going to take the guesswork out of lifestyle recommendations. The patient's going to know exactly what they need to customize their nutrition and what will match their lifestyle and genetics. It's something I would head to genesnp.com for more information. It's such a great product and great tool, and goes hand in hand with our weight loss division because of the different polymorphisms that are looked at and their impact on obesity and propensity to obesity and holding on fat. But then what is the solution? Well, the solution is our TLS weight loss solution, which is a science-based weight management program and can even be used in a clinical setting. We do have weight loss supplements that maximize results, but there's some great online support tools. For a health professional, this can address the immediate needs of your patient and bottom line, but also give patients those solutions for weight loss. It's based on the glycemic index, has many years of science and efficacy behind it, and it's just really simple to use with great guides and journals and, like I said, some online tools. How is this all going to get implemented? Well, it's going to get implemented with your nutraMetrix consultant. This is your partner in implementation who's going to assess the practice, make a proposal with a customized implementation plan, help you out with staff training and education and ongoing support. They'll have your best interest in mind, and the patient will be so thrilled to have customized wellness solutions from their health professional. We can make this super turnkey with a nutrametrix.com patient portal, which will have online educational supports, blogs. You'll be online 24/7 for auto ships and reorders. This simplifies and can automate inventorying in your office by leveraging technology. There's a really great staff back office as well for easy management. The marketing material is a lot of fun, colorful, bright, easy for your patient to be able to connect the dots in the solutions that they're looking for and what nutraMetrix will provide. We have wellness catalogs, rack cards, handouts, posters, things to really catch the attention of your patients, to start asking some more questions about what they can do to be more proactive about their wellness. How's this going to work? Well, the first thing is that a nutraMetrix consultant is going to do a discovery meeting. It's a 15-minute appointment to assess the practice needs, and will then submit to you a customized proposal. You'll evaluate the proposal, make the necessary adjustments, and the consultant will support implementation, train your staff, and ongoing success of the practice based accordingly to your goals. There's 3 ways to earn income. One is from cashback from online purchases and patients' online purchase. The second is retail profits. Simple implementation. Each product has a range of gross retail profit anywhere from 30 to 50%. And then you'll earn some ongoing income. You'll earn commissions based on the business volume of products sold. And tonight I'll show you how you can earn anywhere from $300 to $3,600 in commissions per week per business development center on your product sales. So simple retail model, let's say that this practice has 5,000 patients. We know that 8 out of 10 Americans believe in supplementation, but let's be conservative and say that 65% want wellness alternatives. So our goal is 10% of the base. So our goal would be 500 patients on a wellness protocol. And based on typical working days of a practitioner, we're talking about 2 to 3 patients per day on this protocol. One of our top selling products are these nutraMetrix Daily Essential packets with a multivitamin, a B complex, a calcium, and an antioxidant called OPC3. The cost to the health professional of this product is $55 with a suggested retail of $77. So retail profit is $22. So we can see in the first month with 25 patients ordering, that would bring in $550 into the practice. And as more and more patients order, as we get to that 10% implementation, as our strategy said, and 500 patients are ordering and reordering, we have $11,000 in just retail profit coming in on a monthly basis. If we look at a more comprehensive formula, maybe one of our custom cocktails, one with a multivitamin, a B complex, calcium, vitamin D, and our antioxidant OPC3 at the cost of $93.35 with a suggested retail of $123.02. The retail profit's a little higher at $29.67. And if we look at that same 500 patients on a monthly basis taking this nutraMetrix custom cocktail, that could generate $14,835 into the practice. It's certainly something that could offset the cost of doing business in healthcare today. Additional income is available through volume-based commissions. This is based on the business volume of products sold. I like to relate these to either credit card frequent flyer miles, something like that, except instead of getting miles, when you hit certain benchmarks, you'll get actual commission checks direct deposited into your bank account. So all of our products have what's called business volume or BV volume associated with it. So if we look at these daily essential packets, the BV, the business volume points associated with that product, is 35 business volume points. So 500 patients order, you'll get that $11,000 coming in on a monthly basis as they reorder. That brings in $132,000 annually into the practice. And then you'd earn an additional $31,500 in commissions based on the monthly BV. This is going to add up to total annual earnings of $163,500 coming into the practice, just based on this one simple protocol of one of our top selling products of the Daily Essential Packet. If we look at that custom cocktail, the BV points with this is 64.55. So if we're looking here, our retail profit on an annualized basis is bringing in $178,000 a year. The commissions is going to be almost $58,000 a year, with total annual earnings of $235,920 a year. So we're looking at something that's almost $250,000 coming into the practice from a custom cocktail, with a 10% implementation based on a 5,000 patient practice. We offer 3 different types of accounts. Most people today are starting with what we call our introductory account, or our HP1 account. It's designed for a health professional that is focused on the success of their own practice on their own retail. It's simple, profitable, and automated, and you can upgrade at any time. So a full health professional or an HP executive is for someone who wants to leverage our solution within their referral network. Maybe offer this to some other practitioners who they know might be interested in this retail system. For our non-health professionals, we're looking for full access. We do have our nutraMetrix consultant. It's an advanced account for individuals who want to work with health professionals and leverage their solution. So the health professional 1 account, commissions will work. It automatically gets tracked through the business development centers, and all orders, whether through inventory or online, are credited to the account, and you'll receive commission checks when BV criteria is met. And that criteria, we have a left bank account and a right bank account. So when your left and right bank account gets to 1,200 business volume on the left and right, you'll be issued a $300 commission check. 2,400 business volume on the left and right. As it accrues, this is as it adds up, so that's an additional 1,200 BV. You'll be issued another $300 commission check. Again, it's another 1,200 BV jump on the left and right to 3,600 BV, and 3,600 BV is the benchmark for a $300 commission check. And to finish out the pay cycle, the last increase, the last threshold is a little bit higher, where you have to get to 5,000 business volume on the left and 5,000 business volume on the right, but the commission check doubles to 600 business volume. And whether you hit 1 threshold in a week or 3 thresholds in a week, you'll just be paid accordingly until that payout occurs weekly. You can get additional revenue for groups or referrals. Your nutraMetrix consultant will help you build in a community of health professionals to increase your overall sales. And the system will track the purchases made by your wellness team and orders placed by your patients. And you'll receive 100% credit for all volume generated within your organization. So if you decide to not directly work with practices or individuals and you just want to work with your NC, that's fine. Maybe you have a referral network that includes, another medical doctor, a nurse, maybe a dentist. You'll be credited 100% for not just your own volume, but their volume as well. So that weekly potential for this account is $1,500 a week. But why would you want to upgrade? Well, you'll get more income through shared revenue streams, which this income is based on the sales volume by the entire organization. It can help provide you ongoing income even after you close your practice. This is a solution for a large physician group or health network, and has an opportunity for both the individual health professional and the group simultaneously. So if you refer health professionals who need wellness for their practice and or individuals who can support the implementation process, just going to refer them to your nutraMetrix consultant, and you guys will work together on introducing nutraMetrix throughout your network. And you'll get 100% credit for all sales volume generated by your referred partners. So whether you sell a box of daily essential packets or someone else does, it doesn't matter. The business volume is credited 100% equally. Staff members can be trained as nutraMetrix consultants to support the success of your practice. They also could be certified as TLS weight loss coaches to help your weight loss program. But our comprehensive system has always been designed to provide income to the staff at no cost to your practice. And those who fit as an outside nutrametrics consultant can support this referral development and get certified through our education system. So whether you're a health professional executive or a nutrametrics consultant, get significant income potential and you can leverage additional businesses. There are some additional requirements that include training and monthly requirements, and you'll definitely want to add additional nutrametrics consultants to support additional locations or referrals. I think every health professional should have about 2 nutrametrics consultants to support them to provide this business development support. And so you see, as this all flows up, the same thresholds there, except for these accounts, they have the ability to earn a $600 management bonus. And so the potential there is $2,100 a week with an annual earning potential of $109,000 a year. If you'd like to earn some more income, you can just open additional business development centers. And I do want to refer you to the full compensation plan for further details. But on just 3 of them, the annual earning potential is $327,000 a year. Here's the difference summary. The startup cost for health professionals with either account is $159.95. For a nutrametrics consultant, it's $129.95. There is a monthly order of a back office or our unfranchised management system. For everyone, that's $20 monthly. We never have any minimum orders. Health professionals with the introductory account are capped at $78,000 per year, but our other accounts, there's no limit on the number of business development centers you can have. Our introductory account cannot set up other accounts where executives and nutrametrics consultants can. There's no monthly or annual requirements other than the UFMS and annual renewal for the introductory account. The other accounts do have auto ship, and they also have some trainings that are required. You do need, for HP executives and nutrametrics consultants, 2 accounts are required to earn commissions, but an introductory account, we have just given professional courtesy to that account, and without introducing it to other accounts, they're able to earn commissions. So the next step would be to schedule a discovery meeting with your nutrametrics consultant to determine the best ways to customize these solutions to meet the needs of your particular practice and your patients. Customize the selection of products and services, and then open that account for $159.95. You'll get the nutrametrics account, your website, support materials. It will renew annually for $129. The $20 UFMS will give you the monthly subscription fee for the management systems on the back end. You want to work with your staff, if you have one, to help them understand your wellness vision, and train key staff members to support the revenue, and measure ongoing progress and make adjustments for both the patients and the practice. We're definitely committed to your success with lots of training opportunities, and at the end of this, I'll give you our 2017 schedule. I think it's really important to try some products for yourself, have your nutrametrics consultant customize a proposal, and see if it's a fit for you. So I would like to introduce a really special spotlight tonight as someone who you've heard from maybe before, but not in a while, Dr. Stan Pierce. Dr. Pierce is a doctor of chiropractic, but he has his bachelor's degree in nutrition. Been in private practice here in the U.S., but also overseas in Dubai Healthcare City. He's the international head of EPIC, which is a protocol for chiropractic. He's a university professor currently. But we're really proud of Dr. Pierce for being the first director to hit director, which is one of our income levels, solely on the growth within nutrametrics. He was Health Professional of the Year in 2012 and 2013. And within that time, he has also been consistently one of our top health professional retailers. So Dr. Pierce, did you make it on our spotlight with us this evening?
I'm here. Thank you, Sarah.
Yes, we made it. Dr. Pierce, let me just ask you, unless there's anything else you'd like to add to your bio, but at the time when you were looking at this, what originally attracted you to nutrametrics?
Well, in complete candor, at the time that nutraMetrix came to me, I wasn't really looking. I wasn't desperate. My practice was stable, and I was happy with the way things were working. But like most physicians, I knew there were gaps. There were gaps in understanding that my patient had. There was the question of whether or not my patients were getting the best results possible. So if a doctor's ethical, he's always kind of challenging himself and seeing what he can do to help his patients recover and be as optimally well as possible. So when I first heard about nutraMetrix, a consultant came to our office and was prospecting our team of doctors. And I was actually the one that was most resistant. I was the one who was least interested in talking to somebody about some new product, because as physicians we get approached all the time. However, what I found interesting about the presentation was when they discussed the ability, or the idea at least, of being able to customize a patient's diet and supplements and exercise to match their genetics through DNA testing. I thought that was a very interesting angle for a sales pitch, shall we say. And when I started thinking about that, I said, well, if that's possible, that would give me a unique ability to reach a patient's need that other doctors can't, and I currently can't. So I thought that deserved more investigation. And when I asked the questions and got good feedback and good answers, then I started asking about what other aspects of their company were available. And I learned about isotonic delivery. And I had always known, even in the nutrition program, that the biggest challenge with supplements was whether or not they were going to absorb. And I'd always known that if something doesn't absorb, it doesn't work. So when I heard about isotonics, I was actually intrigued, but also quite frustrated to realize that they had been available for quite a while, and I was unaware of that. So I started using a few of the isotonics and had some pretty profound personal results with the OPC3, with the glucositrin, and started to realize that there's additional results that my practice has been lacking, and that's not okay. You know, no doctor should be satisfied with mediocrity or substandard results, and as hard as I was working with all the knowledge I'd learned to try to help people get well, to realize there's more results that are being left on the table, I was very excited, very, very excited to see what could we really do here. So when I started to enter into opening an account, I was still quite skeptical, though, because you have to remember that physicians are, well, they're guarded. They're guarded about their reputation, they're guarded for the sake of the patient's health, and they don't want to just jump on the bandwagon of excitement. They want something scientifically backed that gets good results. It's going to be a good addition to their brand, their reputation, and hopefully that will generate additional revenues as well. So I was very guarded. So I opened an account with a bare minimum order just to get some products to my patients. And I realized within 2 days, I realized I had a very interesting dilemma, because I was sold out of product. Within 2 days, all the product I'd ordered was gone. And I called my consultant, my nutraMetrix consultant, and said, I don't know what to do. She said, order more. Okay, this is very interesting, because we'd used supplements before, but they were never very effective or unique to the point that patients were really requesting them and excited to request them for their family members, or saying, well, that worked well, what else do you have? And I just found it intriguing to see the energy that was building behind newfound results. And the other part, too, was doctors are sometimes feel threatened that if they were to bring something new into their practice and it were to work very effectively, that somehow that might challenge their identity, what they learned, that somehow it would make what they already were doing inferior to something new that's been brought in. And so I had to deal with that in my own spirit to realize, what's the point here? I mean, the point is to help these patients, to get as great results as possible, as quickly as possible, so that they can get out there and be healthy and refer a bunch of other people to them. So once I got past my ego and I realized, hey, if this is going to help meet deficiencies, and if this is going to help enhance results, this is worth it. Even regardless of the money actually wasn't my driving factor, but the patient results were. But then what I realized was, not only were these new results helping people? But then I realized when I looked at the science and ingredients and benefits behind the isotonic product line, I realized that my patients are ingesting a bunch of pseudoscience supplements from GNC, Target, you name it, just throwing junk in their bodies for the sake of improving their health. And I now had a way that I could protect my patients from buying things that were harmful to them, that they were putting in their mouth because they thought it would help them. So it's where you really start to realize this is about protecting your patients as well as providing them a good holistic natural option. But as things started to roll pretty well in the practice, the next step that I really got intrigued by with nutraMetrix was the whole idea of customizing. And the customization ability with this company is pretty fascinating. Because to be able to customize a product line to match a patient's genetics, as well as you can use the online nutraphysical to get keyed in on present time deficiencies, and using your own clinical experience to gauge what deficiencies may be occurring. You can use 3 different sources: genetics, objective computerized analysis, and your own personal opinion and experience to give a well-rounded, customized approach per patient. And I loved the fact that I could use an independent software program, an independent DNA program, to give credibility and more precision to the targets that I was trying to implement with my patients' wellness and healthcare approach. So the idea of customizing really became intriguing to me right away, and the patients love the idea of customized healthcare. I mean, love it. The fact that you're giving them their own unique formula, their unique approach, and they're not just one of the herd that you're trying to push through the meadow. I mean, you're actually looking at them as an individual and reaching out to their individual needs, and it really creates a kind of a different bond between the patient and the doctor when they realize you're targeting me. You care enough about me that you brought in something specific to me. You know, you're just going above and beyond, and so that really started to help with my relationship with my patients even more. So besides that, then the customization also advanced further, because depending upon what the specialty of practice is, you can create custom formulas based upon condition treatments. And you wouldn't say treatments, obviously, because we're not treating symptoms or diseases, but whatever approach you're customizing for a patient, you can create a custom formula to support that recovery. So I enjoyed making custom cocktails for the patients through how we would order that support through nutraMetrix's unique ability to customize support programs. And that was a real good way of standardizing approaches for patients that weren't quite ready to take their health to a specific customized level for their own genetics and nutraphysical results. We could at least still create custom formulas to support their overall health and wellness recovery program. So that still created a little bit of a unique branding and niche for our practice, and was highly beneficial to the flow of nutraMetrix through our office. So these are some of the main things that really attracted me as we've gone through and really helped to grow and build nutraMetrix inside our practice.
Well, I'm glad, Dr. Pierce, that you are skeptical enough to continue to do your research, yet not cynical, as we do find some health professionals can be in the field when it comes to this. But I know then there became a time where you became excited to share this with peers of your in your industry. Tell me a little bit about that. Like, that must have been unique with this particular line.
That was actually a really fun thing to do. See, a lot of times doctors feel weird about telling their colleagues about this, and probably for different reasons. I know sometimes people think, well, I want to have my own secret approach. I want my practice to be the only one offering this unique brand, this unique product, because it's my secret. And as I lecture at the different colleges around the country, and I talk to the students about these challenges of having a unique identity in practice and being able to thrive in the healthcare marketplace, one of the things I've realized is when you know something is good and it's effective, And if you were to take that and not share that with people, then you're being unethical. And the number one rule of doctoring is do no harm. So what I find interesting is most doctors only apply the do no harm policy to their own clinic walls, what's going on inside their practice facility. But if I have the ability to share with a colleague something he can use and implement to help his patients be healthier and happier, and I don't share that with him, then on the bigger spectrum, I'm harming his patients by not giving them access to these same advanced wellness solutions I'm using with mine, as well as with my own self, my own family. So I feel obligated that I need to let my colleagues know about this. It's not that I want to force them into anything. I'm not trying to sign them up for anything. That's not my call. But they deserve to know about it because I didn't know. So I love sharing with them the advanced results, the unique customization, the excitement of the patients, and especially even the retail revenues. There's a lot of practices that are struggling that need that extra support. And there's money just sitting out there on the table not being absorbed because patients are spending the money somewhere.
Right.
They're spending it at GNC and Target, or they're spending it at some pharmacy, or they're spending it in your clinic. They're going to spend that money. So that's not the issue, is whether patients are going to spend the money for it. It's just a matter of where they're going to spend the money and what quality of product are they getting for that money. So I feel it's important that all doctors are able to give good, natural, holistic options that are effective, that absorb well. And because the higher absorption rate, and you compare that to the price of the product, these are very affordable products, extremely affordable, when you compare especially how well they work. So you got to learn how to compare apples to apples, but I love telling my colleagues about it. And some of them, they say they're not into it. I don't want to push supplements. I'm not a salesman. I'm like, well, that's kind of a stupid statement, because the only way a patient agrees to be under your care if you sell them on the idea that you're worth them signing you up as their doctor. You had to sell them on the idea of getting the x-rays and the idea of getting the exam and the idea of getting the blood work, the idea of taking medicine and the idea of going under life-threatening surgery. You have to sell them on the idea that this is good for them. But you just don't see yourself as a salesman because you've already been programmed to do this by the college degree that you have. So you're selling all the time. It's just a matter of whether or not you're making available options that these people are actually looking for. And once I tell my colleagues about it, most of them are highly, highly interested. I don't find too many of them that say supplements don't work, vitamins don't work. This is or especially the ones that frustrate me are the ones that defer their decision making to entities or groups that influence them. So whenever you have a doctor who's now starting to say, well, my organization I'm part of, they look down on the idea of selling vitamins. I'm sitting here and going, oh, do you work for your organization or do you work for your patient? Are you licensed by that organization? So no, you're not licensed by them. You just are pressured by them. Well, what's going on with your patient? So that's where I really like to help doctors realize that their patients can do better, and why wouldn't they at least look into it? Most doctors are pretty open to it.
Thank you for bringing that up. I would just add to that conversation, which I heard about 10 years ago with nutraMetrix, but it probably wasn't until I became a mom 3 years ago. Also, the point of convenience. I'll never forget being recommended to give my daughter a vitamin D supplement, and I didn't understand why I couldn't walk out of my pediatrician's office with what I needed, or at least some specification as to exactly what to get and where to get it. And that was a very frustrating moment for me as a tired, brand new mom taking home my newborn. And I was like, I don't understand. I walk out of the hair salon with my shampoo that I need. I walk out of places that I go to with exactly what I need. Why can I not walk out with this product for my daughter? I think it took me almost 3 weeks to go get that vitamin D supplement. So.
Well, and think about this too. If a doctor says to you, you need to give your daughter 5,000 IUs of vitamin D per day for the next 2 weeks, and you say, are you sure that's what I need to do for my daughter? And the doctor says, absolutely. I'm certain this is what will help her. and you leave their office and you go down to the convenience store or to the GNC or wherever, and you buy a low-quality, low-absorbing, ineffective vitamin D supplement, and you give it faithfully to your daughter every day for the next 2 weeks, and her health does not respond in accordance with what the doctor told you would happen or that you should do, who looks bad?
Right.
The doctor looks bad. The doctor looks like his recommendation was wrong. But it wasn't wrong. He just did not provide you the last most important step, which is the access to the right quality. Mm. And that's why it's critical that doctors carry this in their office and carry a good quality product in their office that works well.
I know the lucky doctors, though, Dr. Pierce, got about 12 hours of nutrition information in their medical degrees. So I know your stance is very unique, and you're highly educated. And a lot of them are also playing catch up. And they're playing catch up with the education because there's new mandates out there, like vitamin D is no longer on trial. Omega-3s are no longer on trial. You know, where journals are coming out with the benefits of taking things that, like a multivitamin, is now considered standard of care. Can you talk a little bit towards the education that nutraMetrix provides to fill in that gap in education for practitioners who do feel like they're lacking?
Sure, I'd be happy to. So I'll speak to this through my personal example and testimony with nutraMetrix. Doctors love to throw around their credentials. I mean, we went to school, we spent the time, we passed our exams, we passed our boards, and so, we earned them, and we used those credentials to add credibility to our doctoring ability and why a patient should follow our recommendations. So I received and earned a bachelor's degree in nutrition from, I think my degree was approximately 1997 or 98. And let's see, that was a degree I earned from studying textbooks written at least 5 years prior. So I have a lot of knowledge on nutrition from 1992. Now, if I don't go to seminars, read journals, read published studies, if I don't get updated training, if I don't go and receive that and then integrate that knowledge, then I am antiquated. I would be 14 years antiquated. Actually, longer than that. Oh my gosh, I'm so old. That's 24 years. That's 24 years ago. So my knowledge about nutritional knowledge and application for patients are from 24 years ago. So it's critically important that if doctors really want to be effective, they've got to know the new information that's coming out. And that's one thing I appreciated about nutraMetrix was they did offer courses to learn what's cutting edge, what's coming out, what the studies are saying, and how our product line has been customized to match what the studies are saying is the most effective way to approach, helping patients recover. And so there's a lot of arrogance that's out there in the physicians in the healthcare industry, where doctors want to hold on to what they learned so long ago, instead of being humble enough to say, you know what, times are changing. More is being learned, especially with the information age through the internet. Patients are going to come in really knowledgeable about different things, and we have to stay somewhat current so we don't look stupid, and so we actually can advise patients on what to be doing and how to avoid negative approaches. So nutraMetrix training programs for the health professionals are very good. They have a good balance of the scientific application, the protocols, even the training on how to communicate with your patients, how to implement these business systems in place. They do a very good job of a well-rounded approach for the health professionals. And on the other side of it, it's very important that health professionals have support in their practice, because no doctor who is effective and busy in treating patients wants to all of a sudden shift his whole identity and become a nutraMetrix consultant. He doesn't have the time for it. And finding one of his staff members that he can send to be trained in the same systems he's being taught in the health professional program of nutraMetrix is a very effective way of creating a streamlined approach where the nutraMetrix consultant in his office is supporting the systems that are distributing these health and wellness products to his patients, while that doctor is still able to be in that room with that patient lovingly advising them on how to get well, referring them over to the consultant, and being able to make sure the sale is closed, the implementation is done properly, the patient accesses the product, uses the product, and reorders the product. So I really appreciate nutraMetrix's approach to a full education to keep the doctor current and to keep the system streamlined.
Yeah, I agree. We have an exciting 2017. I'm posting our training schedule up here. We're kicking off our training in March in Niagara Falls with one of those dual trainings with health professional implementation and product trainings from the 17th to the 19th at the same time as our first consultant training that we have. And that first training typically does sell out on both sides. But we have a lot to come that isn't even listed on the slide. 2017 is looking to shape up with some new and exciting things, and we're looking towards more online summits and online trainings. We're looking towards some more local and regionalized things to get the information out there, where we're realizing health professionals are so busy that it is tough to take the time out of their schedule to get away from their clinics and practices. And so we're hoping to bring some more trainings out to the field across the country in 2017. So dates for those should be released really soon. And the consultant training, I think you really brought up a great point, Dr. Pierce, to say that a health professional isn't always the most appropriate person to go ahead and make those introductions. So the nutraMetrix consultant training, I think is, and from someone to speak, I've been in sales for 10 years, corporate sales. I've been through pharmaceutical trainings. I've been through some pretty heavy sales trainings, and I always go back to the information that I learned back in 2006 at my first nutraMetrix consultant training, because it just is a really great foundation. So, Dr. Pierce, is there anything else that you'd like to add for what anyone on this call tonight should do right when they are done, and what's the next thing that they should book?
I guess the only last few things to mention is this program provides a lot of confidence for the doctor. As I said before, through the genetics, through the nutraphysical, through these assessments that nutraMetrix has, you can strengthen the credibility of your recommendations for your patients. So it'll add extra confidence to an area of your practice that you may not feel very confident in yet, especially when you go to the nutraMetrix training programs. Additionally, for those people who might be on the call or listening to this recording that are money driven, which as long as you're helping patients get well, if money is one of your rewarding factors you're interested in, that's great. I do feel that it would probably be appropriate to mention how that impact occurred for me. Because the year prior to starting with nutraMetrix, I was carrying a different product line and implementing it to the same patient base that I currently had when I moved over to nutraMetrix. But that last year with that company, we'd only sold $7,500 worth of supplements at 100% markup, which means we bought them for $3,750 and sold them for $7,500. So we made $3,750 in profit on the supplements that year. But the very next year, we shifted and implemented nutraMetrix systems and products and sold $115,000 to the same patient base. But because the products were so much more effective and much easier to use and were affordable and able to be customized, that $115,000, even though you might look at it and say, yeah, but is that 100% markup? No, we actually implemented about a 70% markup, which is even higher than what nutraMetrix recommends. But even if we only implemented a 30% markup, you're still looking at nearly $40,000 in profit versus $3,750 in profit. Remember, same patient base, different effective approach. So in addition to that, when you start looking at the commission checks that accumulate from the BV allocation and understand that system, you can really see that the potential is there. But it doesn't happen on its own. The doctor's got to be willing to be trained enough to get the education to his patients and to get the processes in his clinic streamlined. And it can be done. Anyone can do this. Not everyone will do it. But definitely the program works, the products work, And this company is legitimate, and they're proven for many years, and they're not going anywhere but up and expanding, which means they're going to expand the health and distribution systems and products that we get access to. And I'm excited about that. And the last thing I'll mention is you had mentioned in your introduction, this is a product brokerage company. And that product brokerage company is a very unutilized, powerful point of all of this, because this company is always in a position to be able to improve and enhance their product line with any new data that comes out in the scientific journal showing that they should. They're not bound to any one product. They're not married to an old version of something. They can always expand it. And I remember the first time I saw this happen, where I really understood it, and it kind of caught me off guard. Our company produces an isotonics B complex. So all the B vitamins in an isotonic delivery. And I remember the first time I ordered the B complex, but it showed up not as B complex. It showed up as activated B complex. And B vitamins needed digestive enzymes to activate them for the body to best utilize them. So we used to have to take our B vitamins with food to let the saliva and the digestive enzymes activate them. But then the company found a way to make them already activated. So when I ordered and this product showed up, I thought, hey, wait a minute. Whoa, what just happened? I ordered isotonic B complex, and this says isotonic activated B complex. And I talked to the company, and they said, well, yes, Dr. Pierce, we've upgraded. We've improved it. And I thought, that is really freaking cool. Without me having to go learn more and research more, the company's research and development team already did it for me. And I love being on the cutting edge, and I'm grateful to Market America nutraMetrix for providing that to me.
Thank you. That's such a great ending. Those are really pleasant surprises. And so we're really thrilled to have you be our spotlight interview this evening. I thank you so much for your time. I know how busy your schedule is, so for you to rearrange some things to come to us, this is so great. I thank everyone for being on this call this evening. And if anyone has any questions specifically, you can reach out to us at nutraMetrix at nutrametrix.com. Again, my name is Sarah Tegender, your National Sales Manager, making this your most effective and efficient year yet with nutraMetrix. Hope to see you at one of our upcoming 2017 trainings. Thank you again.